Now, non-governmental organization Send Ghana is asking government to establish a public health emergency preparedness fund with the COVID-19 levy to fight the next pandemic. Deputy Country Director Dr. Emmanuel Eyifa wants government to use the total accumulated sum of the COVID-19 levy in 2023 as seed capital for the proposed fund. He was speaking at the University of Health and Allied Sciences Send Ghana Health Advocacy Incubator Symposium on Public Health Emergency Funding in Ho.
The symposium brought together people in academia and technocrats in the health sector to discuss the country's preparedness for a pandemic. During the discussions, it was pointed out that Ghana was not adequately prepared for a pandemic, gorging events during and after the peak of the coronavirus pandemic. Lack of experts in the realm of affairs of the health sector, infrastructure, logistics and funding were identified as major challenges which should be addressed. The Deputy Country Director of Send Ghana, Dr. Emmanuel Eyifa, advocated the establishment of a public health emergency preparedness fund to help the country strategize and prepare for a pandemic.
But for Send Ghana and for Guy, what we are suggesting rather, that establish the public health emergency fund and let us convert the COVID-19 health levy into the public health emergency levy. Because once COVID-19 levy, it is just for COVID-19. We are saying that rather let's convert that into a public health emergency levy. And the money so far that we are projecting, 2.5 billion for this year, should be used as a seed money for the public health emergency fund.
A professor of epidemiology at the University of Health and Allied Sciences, Professor Fred Binka, advised against the fund being dependent on the Ministry of Finance.
So my first advice to you is that try to find a way that when you establish the fund, practically it's not dependent on the Ministry of Finance. And I will give some examples. So he says timely disbursement of the funds is important. Otherwise, you don't go back and say the national health insurance is not working. And in this case, with a pandemic preparedness fund, we can't accept arrears. Do you know when the pandemic is coming and you are calculating arrears?
The Vice-Chancellor of the University of Health and Allied Sciences, Professor Lydia Aziato, called for proper nurturing, management and utilization of the fund.
The funding is not only for intervention when something has happened, but then the symposium should also discuss how can we use some of the funding to help us prepare, to help us detect and respond or rehabilitate when the situation has happened. So post-recovery activities.
Send Ghana has begun engaging stakeholders towards the establishment of the Public Health Emergency Preparedness Fund. Fred Kwame Asari, JoyNews, Ho.